This couple billed Medicare for $1.2 billion. Neither of them had any medical training, not a nursing degree, not a certification, nothing. Their names are Alexandra Gerke and Jeffrey King. She was 39, he was 46, Phoenix, Arizona. And they ran two companies designed to do one thing: bill the government for medical procedures that patients never needed. The DOJ called it one of the largest healthcare fraud schemes they'd ever prosecuted. And when you hear what they did to a 78-year-old Korean War veteran named Harold, you'll understand why. Here's how it worked. They hired sales reps, not nurses, not doctors. Sales reps with zero medical background. And they sent them into nursing homes and hospice facilities across the country to find elderly patients with wounds. Any wound, any stage. Didn't matter how small. Didn't matter if it was healing on its own. A scratch, a bruise, a bed sore that was already closing. If there was broken skin, there was a billing opportunity. The product was an amniotic wound graft, a skin substitute that carried one of the highest Medicare reimbursement rates of any medical product on the market. So Gerke and King had a rule: always order the largest size, 4 by 6 centimeters or bigger. Even if the wound was tiny, even if it didn't need a graft at all, because the bigger the graft, the bigger the check. And the patients had no say. Most of them couldn't advocate for themselves. These were nursing home residents. Some were in hospice, actively dying. And Apex was ordering surgical procedures on them, not to heal, but to bill. The nurse practitioners they hired were told to ignore their own medical judgment, apply every graft the sales reps ordered. Don't question it, don't document concerns, just apply and bill. If a nurse pushed back, Apex replaced them. They didn't want medical professionals. They wanted compliant employees who would follow orders and generate claims. Here's how bad it got with Harold. 12 surgical procedures in 3 months. 12 skin substitutes applied to his wounds. Procedure after procedure after procedure. The total bill for this one man, $3.5 million. $3.5 million. For one elderly patient in a nursing home. A man who served his country. A man who trusted the people coming into his room in scrubs. A patient who never asked for any of it. His wounds were getting worse, not better. And nobody at Apex cared, because every procedure was another line on a Medicare claim. Then investigators found something that made this case impossible to forget. Maggots. Living insects feeding on a wound that had been subjected to procedure after procedure, not to heal it, but to bill for it. Harold was hospitalized twice for severe sepsis, and he lost his leg below the knee. A man who survived a war lost his leg in a nursing home, not to disease, not to age, to billing fraud. But wait, it gets worse. This wasn't one patient. This was a system. Now here's something most people don't know about how Medicare fraud actually works at this scale. The billing system is designed so providers submit claims electronically. Medicare processes millions of claims per day. The system is built to pay first and audit later, which means if your paperwork looks right, the checks go out automatically. Gerke and King knew this. They built their entire operation around it. The documentation looked legitimate on paper. The billing codes were real. The procedures technically happened. It was the medical necessity that was fabricated. And because Medicare was processing the claims automatically, nobody flagged them until the volume became impossible to ignore. That's how two people with no medical training billed $1 billion in 18 months. They didn't hack the system. They used the system exactly as designed, just for the wrong reasons. They didn't invent the graft. They weaponized the billing code. And the numbers are staggering when you break them down. Each wound graft application could bill Medicare anywhere from $2,000 to $8,000. Apex was applying them to dozens of patients, in dozens of facilities, every single week. Some patients received grafts 3 or 4 times in a single month. The billing was relentless, and every claim was processed automatically by a system that trusted the paperwork. Here's what makes this even more outrageous. The wound graft industry was already under scrutiny before Gerke and King started. The Office of Inspector General had flagged suspicious billing patterns in 2021. Medicare knew there was a problem. And yet, when Apex launched in November 2022, Nobody stopped them. Apex ran this operation from November 2022 through May 2024, across nursing homes nationwide. The total? $1.2 billion in false claims submitted to Medicare, TRICARE, and CHAMPVA, over $960 million billed to federal programs alone. And nobody inside these nursing homes blew the whistle. Either the staff didn't know what was happening, or they were afraid to speak up. Apex controlled the relationship. They brought in the business, they brought in the revenue, and the facilities let them operate. And here's what they did with the money. They lived large, luxury purchases, an expensive lifestyle in Scottsdale, engagement party at the Wrigley Mansion, all funded by Medicare checks that were supposed to pay for patient care. While Harold was losing his leg to infection, Gerke and King were spending his treatment money on themselves. The cruelty wasn't accidental. It was the business model. Court documents show Gerke personally reviewed the billing reports every week. She knew exactly how much each patient was generating. She tracked the numbers like a CEO tracks quarterly earnings, except her revenue stream was elderly people in pain. King handled the logistics. He coordinated the sales reps. He managed the scheduling. He made sure the grafts were ordered and the claims were filed on time. They ran Apex like a Fortune 500 company, except the product they were selling was suffering. But the FBI was watching. And when the case went to court, the judge didn't use legal language. He used 2 words: criminally greedy. Alexandra Gerke was sentenced to 15.5 years in federal prison. Jeffrey King got 14 years. Combined, nearly 3 decades behind bars, for a scheme that lasted 18 months. Gerke was ordered to forfeit $279 million. King, $130 million, plus a $309 million civil settlement under the False Claims Act. The total recovery order, over $700 million, one of the largest in healthcare fraud history. The government wanted every dollar back, and the court agreed. This case was part of a larger pattern. In June 2025, the DOJ launched its biggest healthcare fraud takedown in history. 324 defendants charged. $14.6 billion in fraud. Apex Medical was one of the largest single schemes in that sweep. And this is Alexandra Gerke. And this is Jeffrey King. 2 people from Phoenix. No medical license, no nursing degree, who walked into nursing homes across America and turned dying patients into a billion-dollar billing operation. The wound graft industry has since come under intense scrutiny. Medicare has tightened reimbursement rules, but for patients like Harold, those changes came too late. He lost his leg. They lost their freedom. And a courtroom full of people wanted to know the same thing. How did the systems that were supposed to protect him, Medicare oversight, facility compliance, nursing boards, state regulators, how did every single one of them miss it for a year and a half? While patients suffered, because the couple who billed Medicare for $1.2 billion, they didn't need a medical degree, they didn't need a hospital, they didn't need a single qualified nurse on staff. They just needed a billing code, a product with a high reimbursement rate, and a system that was designed to pay first and ask questions later. If you want to follow cases like this, subscribe. New case every Tuesday, Thursday, and Saturday. The Reckoning Files.